millimeter endobronchial nodule.
Okay, so we'll hold off on surgery until we find out what that is.
So they say that now in hindsight, looking back at your, this is usually what happens, by the way. When you start getting scans here, our radiologists start exploring all these outside scans you had, and they find, oh, wait a second. On your outside scan, you had this spot in there, you know, and so that's the question. What do we do about this spot? And so Dr. Dasari is going to take a look at you and see what do we do about this 8 millimeter spot. They say in hindsight now they can see it as early as February, which makes sense actually. That means it's probably real. They've seen it on 2 scans in a row. It was just missed by the previous radiologist because it was so small. It's stable, just like your pancreas is stable. Okay, but the question is, what do we need to do about this? Do we need to biopsy this, or do we just keep an eye on it and put you on the medication to hold things in check? Okay, so I'm going to have you see Dr. Dasari, who specializes just in neuroendocrine. He's a neuroendocrine medical oncologist. Okay. And then, you know, he'll evaluate it. We'll keep presenting you at tumor boards, and once we get to a point where everybody feels comfortable that surgery is the right answer, then we talk about doing surgery for the pancreas. And once we prove that this is the only spot in the lung, then we even probably talk about doing surgery in the lung if that's the only spot. You can see how if I hypothetically did surgery on your lung today, that could be a mistake if in reality 3 months from now you have it also in the opposite lung or higher up. You're like, oh, we just did the surgery. Why do we have to do another one now? You really want to see how things develop so you can capture it all at the same time.
So is that maybe something spreading right there, or no?
No, we don't think it's spreading. We think that rather it's a separate primary. So when you have MEN1, you have multiple primaries. For a patient who doesn't have MEN1, if you have something in the lung, it came from the pancreas to the lung. That makes sense? It's a metastasis. Yes. But in your case, you have something called a field defect, a field like a grass field. Your whole grass field has problems, and weeds can pop up anywhere in your grass field. And so you have weeds that are in your pancreas, 3 of them, one in the head too tiny to see, one in the tail I can see, and in the 2.5 centimeter I can for sure see. This is pointing out that you have weeds in your lung. Now, at least one of them 8 millimeters and a couple indeterminate 4 millimeter areas. And the question is, do you have more weeds that might pop up in the future with the MEN1? If there are, you can imagine I would like to take out all the weeds at the same time, not take out one here, one there, because the weed analogy doesn't fit there because it's not as easy as weed eating. It's surgery. So if we're going to do surgery, we would like to make sure we can get it all at one time if we're going to go that route. And I have another patient in a similar situation to you where she's got multiple spots in the pancreas, and I've waited now up to 8 months waiting for the right time to do it to make sure that she didn't spread everywhere else. So it really is a scenario that we have to be not just doing the surgery that we can do, but trying to do the surgery we should do.
Okay.
All right, so we'll arrange for you when you come back next week. So we'll cancel your surgery appointments and the anesthesia and the EKG and all that. But when you come back to see next week, you have an MRI on Monday.
Okay.
Well, I think you have a laryngoscopy because you're hoarseness, right? Because that's kind of unusual. And then you're going to get a brain MRI, Heimberger on Tuesday, and maybe see Dr. Dasari on Wednesday. So just plan on 3 days here at MD Anderson because Dr. Dasari sees people on Monday and Wednesday, but he probably wants to see you on Wednesday after you had your MRI of the brain because he doesn't want to jump the gun. If you're going to get a brain MRI, he wants to see you after that. Okay.
Okay, what are we going to do on Monday with my throat?
Scope.
Scope?
Okay. Scope on Monday. You're going to see ophthalmology for some reason? Was there a reason for ophthalmology?
I've already seen them a couple of times.
Okay, so follow. Okay, and then you're going to get a brain MRI on Monday. So 3 things on Monday. We can print this out for you. And then see the neurosurgeon the next day just to make sure everything's okay with the brain. And then on Wednesday, which is not on there yet, you'll see Dr. Dasari. So we'll do Wednesday.
Okay.
Okay?
How about